What we're doing is we're transferring fat. Where did we take the fat out from, Delisa?
So I got it from my full abdomen, right? My entire abdomen, and then my back rolls.
Okay.
So all of that is transferring to my hips. But like, you guys have been absolutely amazing. Like, I have no questions because you guys answer everything before I even can think of the question. Everybody's been happy and smiling. Like, I'm up right now talking to you while I'm getting the surgery.
Yeah, so she's actually having her hip flipped right now.
Right now.
So tell us what brought you into Elite, what your goals were, and tell us what happened.
I've always had an issue, I guess, with my overall shape. So I've always had a little butt, but I never had that kind of fuller hourglass shape to match. So I was definitely lacking in the hips. And I hated how they concaved. I hated how it looked in my clothes. So I just wanted something more kind of smoother, but not focusing on my butt, just my hips.
It's kind of like where your leg bone connects to your hips. It's typical that people have a depression there. It's normal anatomy, actually. Absolutely. We take arm fat all the time. Arms are one of my favorite areas, as many of you might know, because they look so perfect afterwards. The skin tightens up so well. They look smooth. And arms are a great place to harvest fat for a hip flip. So you certainly can use arm fat. You can use fat from literally anywhere. It is considered semi-permanent. It should last at least 5 years. I did people 8 years ago and it still lasts. So we consider it semi-permanent only because there hasn't been a study of someone who's had it 25 years ago. But as far as I'm concerned, once the fat takes and it's healed, and it should stay exactly the same forever. Saddle bag is outer thigh fat. A hip dip is actually a dent above the saddle bag. It's your own natural body. We're just recycling your unwanted fat and putting it where you do want it. We're repositioning fat. A hip implant is obviously an artificial material that has a lifespan, would likely have to be removed at some point. There's nothing similar between a hip dip and hip implants, nothing similar in any way. Yes, you can. So some people get a hip dip combined with a BBL, very common, that's our power BBL, and if you have a hip dip, we typically will fix it unless you don't want to. That's part of our average BBL right there. That question is really more for someone who wants a Brazilian butt lift. So sometimes when we do a Brazilian butt lift, we will fill in the hip dip. So if you want a bigger butt, then the answer is we do a Brazilian butt lift. And we, of course, if you have a hip dip, we always fill it in.